Hello, my name is Laura and I am the clinical consultant for the TENA brand at Essity. In this video, I would like to introduce you to Introduction to Incontinence. In this video, we will discuss the healthy bladder and bowel and different types of incontinence and useful tips. The International Continence Society defines urinary incontinence as the complaint of an involuntary leakage of urine. This definition is not enough on its own. Each person's individual circumstances also need to be described. This includes which type of urinary incontinence, how often it occurs, and how much urine leakage there is, and when it occurs, and what impact this has for their personal hygiene and quality of life of the individual. It also needs to describe what steps have been taken to prevent urine leakage and what assistance the person needs. Urinary incontinence is one of our greatest public health disorders. It is a global problem. It affects around 400 million people. Due to an aging population, the problem with urinary incontinence is expected to grow. It is underreported, underdiagnosed, and an undertreated problem that increases with age. However, it can affect anybody at any age. Sometimes relatively simple measures can reduce the costs of incontinence care while improving the quality of life for the individual. Before we look at what incontinence is, we should first consider what a normal, healthy bladder is. The bladder is a muscle known as the detrusor muscle. It has two important functions: storing and emptying urine. The kidneys produce around 1,000 to 2,000 mils of urine within a 24-hour period. Your bladder on average should empty 4 to 7 times a day. A normal healthy bladder will be able to hold 300 to 600 mils of urine at any one time. Age does affect bladder capacity. An elderly person's bladder may hold much less due to changes associated with normal aging and decreased flexibility of the detrusor muscle. What is the impact on quality of life? Quality of life is such an important factor in this condition. Here are some of the possible impacts it can have. People with urinary incontinence, regardless of the cause, tend to have more falls, use more medication, and have a larger number of other health-related problems and disorders. These people also have greater need of help in daily life. They also might have reduced mobility, which affects toilet visits. This dependency is an important factor for reduced quality of life. Urinary incontinence may also disturb sleep, which further impacts daily function. There is also an issue of social stigma. For most people, urinary incontinence is a personal hygiene and self-esteem problem that is difficult to talk about. Many will experience a constant fear of odors and leaks and embarrassment in using and disposing of incontinence products. They may also experience a dependency on being near a toilet. What can you do? As you have already discovered, having urinary incontinence can really affect a person's well-being in different ways. There are, however, a lot of preventative actions and treatments that can be used. The target for care should be on improving these health problems as a whole, as they all interact with each other. Therefore, nursing staff need to take the lead and actively ask the person if they have any problems with incontinence. Stress incontinence is the involuntary leakage of urine on effort or exertion. The pelvic floor muscle provides a sling-like support for the pelvic organs, and they are very important in maintaining bladder control. If the muscles and ligaments become weakened, stress incontinence can occur. The symptoms are leakage of urine when coughing, laughing, sneezing, or exercising. The pelvic floor muscle can weaken for many reasons. The most commonly known cause is childbirth. Other causes are chronic cough, menopause, chronic constipation, and obesity. There are exercises that can be done to help, and there is further information online and via your healthcare professional. We must all take care of our pelvic floor muscle by doing exercises, including the men, as everyone has a pelvic floor muscle. Urge incontinence. An individual with an overactive bladder will get a sudden urge to pass urine and will need to go to the toilet more frequently. Where they are unable to manage this overactivity and develop symptoms of incontinence, then this is considered to be urge urinary incontinence. Urinary tract infections and constipation can also cause symptoms of urge incontinence. As well as increased frequency, where often small amounts of urine are passed, they may also have to get up more than once in the night. Urge incontinence is a known risk factor for falls. Many people with incontinence think that reducing fluid intake will help relieve symptoms. This can, in fact, have the opposite effect, as concentrated urine aggravates the bladder and can make symptoms much worse. This type of incontinence is treatable with some slight changes to the individual's lifestyle, such as diet, types of fluid intake, medication, and bladder retraining. Overflow incontinence is the involuntary release of urine due to a weakened bladder muscle or to a blockage. An enlarged prostate or constipation are the most common causes. Symptoms include hesitancy, weakened stream, and stopping and starting of urinary flow. The bladder never empties properly, and so urine builds up in the bladder. This is called urinary retention and can result in the bladder becoming overstretched and enlarged. The residual urine left in the bladder increases the risk of developing an infection. Treatments include providing medication to increase the activity of the bladder muscle wall, surgery to remove any blockages, or treatment to relieve constipation. Neurogenic bladder is a bladder dysfunction caused by neurological damage. Often the messages from the brain to the bladder are interrupted. Individuals can experience symptoms of frequency, urgency, and retention. Although the urinary incontinence symptoms can be quite diverse, risk of urinary infections is high. This can commonly be found with people that have suffered a stroke or that have Parkinson's, MS, dementia, and/or diabetes. Treatment options will depend on the underlying causes of the incontinence. A person with functional incontinence can have a bladder that functions normally, but has other physical or environmental challenges that affect their ability to cope and maintain continence. For example, a person with dementia may have a normal functioning bladder, but due to memory impairment, they do not remember where the toilet is, or they may have impaired dexterity and are unable to manage their clothing. Management options would focus on strategies to reduce the effect these challenges have on the individual. For example, introducing clear signage for the toilet or changing clothing to allow for easier clothing removal. Let's now consider bowel function and incontinence. What is a healthy bowel and why is it important? To have a healthy bowel means to have a bowel movement between 3 times a day or 3 times per week. I would like to highlight that everyone does have their normal bowel pattern, and if their pattern deviates from the norm, even within normal parameters, and persists, then this may need to be investigated. Ideally, you would like to see a type 3 or type 4 stool as per the Bristol stool chart. Opening your bowels shouldn't be a painful process, and you should feel satisfied that you have emptied your bowels fully each time. Often, the abnormal function of the bowel can be the underlying cause for urinary incontinence. For example, if you are constipated, then this can cause overflow incontinence or urge incontinence symptoms. Fecal incontinence is the involuntary loss of liquid or solid stool. Most of us will have experienced the urgency, nausea, and even severe pain that a bout of diarrhea can cause. In the elderly and those people with impaired mobility or confusion, episodes of severe diarrhea can result in fecal incontinence. Constipation and fecal impaction, which can result in overflow diarrhea, are the most common causes of fecal incontinence. There are many ways to help maintain a healthy bladder and bowel. An adequate fluid intake of at least 1,500 ml, although this will depend on each individual, along with a balanced diet, is essential. Consider the toilet facilities and ensure they are private, clean, and that there are hand washing facilities available. Help the person to the toilet regularly and when needed. It is important not to rush anyone when they are using the toilet to encourage total emptying of their bladder and bowel. A good toileting position will also assist with this. If a person is very immobile and physically impaired, you should prioritize a toilet visit in the morning, right after their breakfast, to facilitate bowel movement, making the most of the gastrocolic reflex. When food enters the stomach, the body releases a hormone that causes the colon to contract. These contractions move previously eaten food further through the digestive system, which can result in the urge to pass stool. Please note, if you are unsure of the amount of fluid you should intake daily, please discuss with a healthcare professional. Consider the environment and the individual. Is the toilet easy to find? A toilet seat in a different color makes it easier to identify where they need to sit. Do you need to move them closer to the toilet to make the access easier? Is there a need for a urinal or commode by the side of the bed or mobility aids? Consider the individual's clothing. Are they struggling to remove them each time? Remember, incontinence is not a disease, but a symptom of an underlying medical or environmental issue. It is not inevitable due to age. Anyone with incontinence symptoms or new symptoms should always be assessed and investigated by a healthcare practitioner, so that a treatment and management package can be put in place. The effects to an individual with urinary incontinence should never be underestimated, as it does not just impact their physical well-being, but also their mental and social well-being. I hope that you have found this video useful. Please remember that you can access the further information via our TENA website or by contacting your local TENA representative.